Value-based criteria. This is the most proactive solution we created. We know from our research that a criminal record can stifle one's ability to function in society. A drug charge hinders one's ability to get a job with ease, get financial aid for continuing education, and can ruin familial relationships, to name a few consequences. The solution would stop the stunting of a person's life from making a mistake with drugs and get them the help they need by allowing them to move forward with their life and recover without a criminal record. Blanket rehab for all drug offenses would drastically reduce the amount of people addicted to drugs. Our literature review showed the success rate of rehabilitation programs in general and how stunning the effect can be on drug offenders. An impressive number of those in the system that complete their programs are clean 5 years later and have far fewer, if any, future arrests. Even those that do not finish their programs do better, as was discussed above. Making drugs legal, up to a 10-day supply, as they did in Portugal, would immediately make millions of Americans law-abiding citizens, instead of people trying to survive their drug addiction while occasionally committing the illegal act of buying and using drugs. It would also erase the stigma attached to potentially getting a drug conviction that could ruin their life. Many people are functioning drug addicts, and we know from the success of harm reduction that people can be progressively successful, professionally successful, while still using drugs. They need not be made criminals for simply trying to survive. Making previous drug offenses null and void would greatly reduce the economic impact on federal, state, and county incarceration budgets. This would free up a great deal of money for our proactive rehabilitation program, and because it's 90 days instead of 2 to 3 years, drug court and rehabilitation system, this would free up a great deal of money for our proactive rehabilitation program, and because it is 90 days instead of 2 to 3 years, like drug court and rehabilitation systems, a great deal of taxpayer money would be saved, as will be discussed in the following cost analysis section. The money aside, millions of people would get their lives back. The disservice that the war on drugs and the current safety model, law enforcement protects the public from deviant drug users and offenders, has done to so many people is appalling. A great deal of the people that are in jail or prisons for drug offenses could have lived productive, prosperous lives had they not been saddled with a criminal record. As mentioned, our rehab program will be 90 days with 9 months of life skills counseling to include help with housing, job acquisition, and therapy if needed. There will also be monthly drug tests. Should they fail a drug test, more probation time will be added on a case-by-case basis. If a person stops going to their 90-day rehabilitation, they will go to jail and complete rehab with no criminal charges. If they quit the program in jail, it starts over, and they stay in jail. They oversee how much time they spend behind bars. They oversee how much time they spend behind bars they oversee how much time they spend behind bars if it comes to that. This will be substantially easier and more effective for people in the system than jumping through the drug court and rehabilitation hoops mentioned in Section 1 by Dr. Sotheby. An examination of the effectiveness of the policy. This policy would greatly help the citizens of the U.S. by creating a new view that looked at them as human beings instead of deviant drug addicts or offenders. We have taken all the positive aspects of rehabilitation, avoided the staggering cost and time investment of drug court and the current rehabilitation court requirements, and created a forgiving, human-centered program that allows for the subject involved to flourish and have a hopeful future. At addressing the problem of too much incarceration and not enough realistic rehabilitation treatment, this policy is a comprehensive and effective starting point. Cost analysis. As discussed above, Michigan taxpayers spend an average of $35,809 to incarcerate one inmate. Drug court can cost the offender out of pocket from $3,000 to $13,000, as listed above in our literature review. There are 400 drug rehabilitation agencies in Michigan with a plethora of different services and prices. The Michigan average is $1,000 to $1,500 for detox, $6,000 to $60,000 for inpatient programs with varying levels of time and depth of treatment, outpatient programs that cost $5,000 for a 90-day program, and in the cases where people need medication, like methadone, the price tag can be around $4,700. What aligns with our proposal the closest is the outpatient programs that average $5,000 for 90 days. In California, the drug program costs over $3,000, as was listed in the literature review, so there is some wiggle room for the cost per person. Because around 67% of people who successfully complete outpatient drug rehab programs have their treatment costs covered by Medicaid, Medicare, and other government sources, the cost to the taxpayer would be zero to negligible depending on what insurance the subject had. The types of insurance that rehabilitation centers currently take are Medicaid, Medicare, state-financed health insurance, private insurance, and military insurance. In addition, there are non-competitive SAMHSA grants for rehabilitation programs that only need to be applied for, and the overwhelming elephant in the room, the reduction in incarceration budgets for prisons. The money saved by the prisons could be better used for rehabilitation.